Ang alam natin na ang cervical cancer, di ba, is caused by a virus. It's human papilloma virus or we know it as HPV. Kapag natamaan ng cervix ng infection o high-risk HPV infection, nag-at risk siya for cervical cancer. Hindi lahat ng natatamaan ng infection will have cervical cancer. But of course, mas mataas yung risk mo if meron kang HPV infection. So, ang una munang nakikita dyan, ang kadalasang complaint ng mga pasyente ko sa akin, cervical cancer, is yung nagsaspotting pag nakikipagtalik or biglang bumubulwak yung bleeding kahit hindi naman mo period, no? Sometimes kapag nasa advanced stage na tayo, masakit yung puson, masakit yung balakang, yun yung mga unang senyales. And then some other would complain of may discharge na hindi maganda yung amoy, may color green o white or watery discharge na tuloy-tuloy na lumalabas sa vagina nila. It's ang cervical cancer, pag muna in the Philippines, it's one of the most common, no, gynecologic cancers. But when you compare it in first, second world countries or developed countries, mababa sila, mataas tayo kasi wala tayong vaccine. So unlike pag first world country, lahat bakunado lahat. So mababa yung rate nilang cervical cancer. Ngayon tayo sa Philippines, yun yung gusto ko ding ma-aware, lalo na Cervical Cancer Month, is to get vaccinated. And yung pinaka-bago ngayon is the 9-valent or the non-valent HPV vaccine. Yan yung binibigay sa, ideal siya at ages 9 to 14 years old. Pag wala pang sexual contact ang bata, dun siya binibigay. When you're at that range of 9 to 14 years old, you get injected twice. Pag lagpas ka na ng 14 years old, you have to inject 3 times, no? Pero again, mas maganda wala pang sexual contact yung babae para mas protected siya. Kasi before magkaroon ng infection, before ng sexual intercourse, you have the antibodies already against the HPV virus, the human papilloma virus, no? Pero kunwari, nalagpasan mo na yung 9 to 14 years old, okay lang kahit na 25, meron tayong mga catch-up period, 25 years old, 35 years old, pa-vaccine pa din tayo. So, the HPV vaccine, no, lalo na pag na-inject ka, alam mo naman, it allows you to have antibodies. So, kunwari, nag-first sexual intercourse yung babae, you get that HPV viruses na meron na yung katawan mo na antibodies. So, it will stop the virus from infecting the cervix because you have antibodies already. No, it protects your cervix already. But again, only for those strains na meron yung vaccine. So you can have infection, you can still have cervical cancer when you get vaccinated. And also, when you get vaccinated, it doesn't mean na hindi ka na magpapa-screening or magpapa-pap smear. You still have to do that. Dahil yung non-valent vaccine natin or yung 9-valent vaccine natin, it protects you from 7 high-risk HPV types and 2 low risk, no? Yung 7 na high risk na yun, konti lang yun sa 30 to 35 na dami ng high risk virus na iba-iba. So it protects you only for that certain 7 strains. Pero yung ibang strain, hindi ka pa rin protected. Number 1 talaga, of course, no, I have to say it, it's sexual contact at an early age. No, tapos of course paiba-ibang partners, no, or polygamous yung partner, madaming partner ikaw, of course you have higher risk of contracting the human papilloma virus, no. Needless to say, a decreased immune system, pag mababa immune system mo, you're more at risk of contracting it. And then also having decreased folate, no, in your body, poor nutrition, of course that contributes. Of course, smoking, sa lahat naman ng cancer, ano yan? Increased risk. Dalawa yan eh. Parang dalawa yung peak niya, no? So, isang 35 to 45, mas mataas yung rate ng cervical cancer, and isang 55 above, no? Mas mababa ang cervical cancer sa mga kababaihan nating less than 30 years old because mataas pa yung immune system, no? Immune system nila. Pag nagkakaroon sila, na-infect sila na HPV, nawawala because of their good immune system. You just have to have proper diet, proper sleep, no? Increase immune system na tatanggal sa katawan nilang infection. So when you get cervical cancer that is not early stage, Of course, we have to treat it, and the treatment to it is either hysterectomy or chemoradiation. And when we do hysterectomy, chemoradiation, either we remove the uterus or we radiate the uterus. So it wouldn't allow future fertility. But when we get patients who want fertility at they have early stage cervical cancer, we can just remove the cervix. No? So pwede pa sila mag-pregnant. Although wala yung cervix, their uterus can still hold the babies. We need to have pap smear done at age 30 or 35. It depends on the risk factors of the female. No? But what's more interesting, it's there's a new technology that's more recommended. It's the HPV typing, but mahal siya. It's expensive, no? That HPV typing will detect if you're infected with high-risk human papilloma virus. No? But for now, we can do pap smear. We have to do pap smear every, pag nag-normal siya, we can do it every 3 years. No? And then kapag nakita mo naman high risk yung lifestyle ng patient, it's every year. It really depends on your pakikiusap sa patient kung high risk siya o hindi, and if she's willing to undergo yearly pap smear. So other ways to prevent cervical cancer apart from vaccination, of course, is monogamy or abstinence, no? Walang sexual contact, or if you're going to practice sexual intercourse or sexual contact, better to protect yourself, safe sex with a condom. Condom use tayo. Of course, you have to increase your immune system, have a good night's sleep, take vitamin C, keep your immune system up. So, visit MakatiMed, no? Especially your OB-GYNs, no? All doctors in our department, in the Department of OB-GYNs, offer vaccinations against HPV, and of course, screening, whether it be pap smear or HPV typing. Come visit us to undergo the proper screening for your age.